Hello, and welcome to another Edison TV executive interview. My name is Aaron Atkar, and I'm an analyst here at Edison. We're joined today by Newhouse, CEO of Kooth, and Sanjay Jawa, the company's CFO.
Hi.
Kooth is a UK-based company and a global leader in youth digital mental health. Kate, Sanjay, thanks for joining today.
Thank you for having us.
Aaron.
So Kate, for our audience, can you briefly introduce yourself, share some of your background, and touch upon what drew you to Kooth?
Absolutely, thank you. So, hello, I'm Kate Newhouse, CEO at Kooth. I've been at Kooth for over 5 years. I was Chief Operating Officer and Board Director before becoming CEO in January of this year. Before that, I've got 20 plus years of experience in senior leadership positions across digital and healthcare, with particular and deep expertise in go-to-market strategies. Started off as a strategy consultant 20 plus years ago, then as CEO and co-founder of another global digital healthcare company called Dr. Care Anywhere, taking it from inception to Series A back in 2017, and before then becoming CEO of a digital venture builder, Blenheim Chalcott. And I think in terms of what drew me to Kooth, I'm really passionate about digital healthcare, providing that reach and impact through innovation to support individuals to have better lives, both on an individual basis, but also then to be able to have that impact at a wider societal level. And that's certainly been a guiding thread through my career. Back in the noughties, when I was writing digital strategies for local authorities and NHS trusts, Kooth was actually one of my flagship case studies in the back of those digital strategy reports. So it feels very full circle to come back and lead Kooth as CEO.
Excellent. So the company presented strong 2024 results. Can you talk us through some of the key figures, give us an overview of the key financial and strategic highlights from the year?
Yeah, will do, Aaron. Being in July, and it feels slightly stale talking about 2024, but we were very proud of the numbers we achieved in 24. Revenue doubled to 66.7 million. And that was very much driven by our contract with the state of California. This was also supplemented by a Medicaid contract we won with Aetna, Illinois. The UK was relatively flat, I would say, and we'll probably touch a little bit more about that in a sec. But so strong revenue growth. And that also drove, at the very end of last year, we also won a $1.5 million pilot with New Jersey, which would feature in our ARR, annual recurring revenue, at the end of last year, but will only sort of start to hit revenue in 2025. And that strong revenue growth really drove, an excellent gross margin. Gross margin was 78%, just ahead of the previous year. And what we saw was our new platform we launched in California 1st of January in 2024. What we were seeing was a much greater use of the self-help tools within that platform than what we've traditionally seen in our classic Kooth platform. Around 75 to 80% of our users were getting the help they need from the content, the community, the self-help tools, and around 20 to 25% were using the practitioner services. So, the coaching services that are available either through a user booking a session or having a drop-in chat with one of our practitioners. And that really sort of drove a strong gross margin. We're never going to be at a SaaS level gross margin, 80, 90%, 85%, because we'll always have that human element to the work that we do. The gross margin was slightly reined in a bit by our direct marketing spend in California. This is media spend to engage with young people, to make them aware of our services. And that was around 4 million sterling in 2024. And that strong gross margin, that strong revenue gave us a record EBITDA, which was just under 16 million. We kind of think of that as a bit of a unique number in 2024, very much driven by the first year of a contract as it starts to ramp up in value. As we start to invest more heavily in marketing across California in particular during the course of 2025, I'd expect that EBITDA number to sort of return, to market expectations are showing around 10.5 million for 2025. So I think we'll sort of be within that ballpark, and margins themselves will be returning to sort of more kind of mid-teens levels. So very much a unique year in terms of EBITDA. We finished the year with net cash of 22 million sterling, driven by strong working capital, as well as cash generated from operations of around 17 million. We invested in the platform last year about 7 million sterling. That was just a little bit below 23, where we started to build out the Soluna platform. And we remained debt-free. Just after the end of the 24 financial year, we had a 1.5 million sterling buyback. That's something that we would think about again in the future. And all that led to a profit after tax of 8 million sterling. So, I was very pleased to see that on the sort of Apple Stocks app I have on my phone, that we now finally have a PE ratio, which is a great place to be.
Fantastic. So you've alluded to it just there a little bit, but we've really seen the encouraging headway in the rollout of your services in the US. So can you share a bit more color on how this expansion's going, the company's strategy to secure further contract wins? And then could you also maybe touch upon the key takeaways from the recently announced impact reports on California Soluna data?
Yes, I'll answer the beginning and the end of that question together first, which is we mentioned in our annual results that we had some key headline results in the first 15 months of our California contract. So really hitting some key objectives of the Department of Healthcare Services for reaching those people in greatest need earlier in their healthcare journey and those that wouldn't typically access mental health services. So we're really pleased to report that 1 in 3 wouldn't have anything else if they didn't have access to the Soluna platform. 50% of our users are coming in for first-time mental health support, and over 57% of our users are from areas of greatest high health inequality across the state of California. We can also see from the recent impact report that Department of Healthcare Services in California released a couple of weeks ago shows excellent progress, with usage reaching over 117,000 users at the end of May. That's up from 75,000 at the end of February. And so in those 3 short months, you can see usage has grown by over 56%, reaching over 2% of the population at this point. They've also reported some really important user testimonials, as well as some statistics of how users are using the platform and how they are feeling about using the platform. So 97% of our users would recommend Soluna to a friend, 82% feel left alone after using the application, and 99% of users who received coaching felt heard and supported, all of which, in our view, definitely evidences the positive impact that Soluna is delivering in the state. So this usage uptake, coupled with meeting those important wider objectives in terms of user reach and access, as well as meeting all of our contractual obligations, we know that in our relationship with the Department of Healthcare Services that we have a happy client, that we're on track to deliver the target of 1 in 44 of the population by the end of 2025. And really importantly as well, we've made great progress towards system integration with healthcare, education, and community organisations, with a number of those key organisations as vocal advocates for the programme. So further afield than California, we've definitely ensured that all of our learning from our pipeline work in 2024 has been absorbed and fed into the work that we're doing now. As Sanjay mentioned, we secured a contract in New Jersey covering the school-based population across 4 counties and went live with that at the very beginning of this year, having closed that contract on the 24th of December 2024 and going live on the 7th of January 2025. And it's really important that we are securing system partnerships up front. So we are creating that system awareness through our existence in the system, how we fit with their provision and the benefits that are brought to those players, so that we can make sure that we are foreshadowing future funding approach and expansion opportunities within the state, together with other funders, in addition to the legislative funding route. Given the length and complexity of the legislative funding process, we also are seeking longer year length contracts. So we're looking at 3-year as we move into 2025. And that gives us the time and space to make sure we're delivering and demonstrating that impact and start building the foundations for a more coalition funding approach for that expansion across the state, in addition to that legislative funding foundation that we have secured. So that's really kind of paints a bit of a picture of how we're moving outside of California.
So turning now to the UK, the UK presents a challenging environment in terms of macro factors and policy changes. So can you talk to us about how Kooth plans to navigate this at a time when mental health challenges are on the rise?
Absolutely. So just reflecting on 2024 for a moment, NHS funding pressure absolutely continued right the way through that year. And so therefore we sort of faced that challenge with making sure that we were strengthening our local commissioner and stakeholder relationships and ensuring that we are positioned for new policy priorities, obviously with a new government, relatively new government in the UK, at both a national level and actually beyond the NHS. So with that system integration work, we've secured some longer term contracts with existing commissioners, and we've also seen some early signs of some new funding streams. So as you alluded to, the lack of effective mental health support in both the sub-threshold cohort, those waiting and those unable to seek timely support, is being recognised, not just at an individual and health system cost, but actually critically as a key driver in economic inactivity, particularly in the 16 to 35 cohort. So the focus of the current government on Get Britain Working acts as a fertile backdrop for mental health providers who can deliver positive outcomes at scale and quickly with little setup and infrastructure, and can partner with those providers who can deliver that evidence-based back to work, training or education support. So in the UK, with the 200,000 people that we reached in 2024, we're still very much the embedded digital front door across a lot of the UK. But we do see that whilst there are high-level policy shift signals that are moving out of hospital, a focus on digital and a focus on prevention, I think realistically, notwithstanding the 10-year plan that's due to be published in the next couple of days, we will continue to see funding pressure in the next 18 months. But we see those opportunities of the £200 million funded initiative through that Get Britain Working white paper, where we can wrap ourselves around some of those opportunities to provide that mental health, in particularly for young people who are for them to stay or to get back into education, training and work.
Taking a step back now, Kooth has pioneered the responsible use of AI to enhance digital mental health services. So with AI capabilities now coming on at really quite an astonishing rates, can you discuss how Kooth is now working with AI to support both nearer and long-term goals?
AI has huge potential to support our mission to improve population health at scale, but I really want to be clear that it must be developed and deployed within a safe, ethical and evidence-based framework to ensure that we can effectively mitigate for risks. To that end, when developing AI solutions for use within our services, we take a human-centred approach. So we're focusing on areas that will best support our service users, our practitioners and our wider staff, rather than replacing well-evidenced models of care with systems that we believe are not yet proven to work. So for instance, rather than using AI to replace practitioner-led care, we've been developing and testing AI solutions that focus on assisting practitioners with routine tasks, such as writing up notes, moderation of content, and enhancing our understanding of service users so that we can better personalise their care and enable that sort of real-time monitoring of service quality and inefficiency. We believe that regulatory frameworks for AI are still pretty much in their infancy, and so the deployment of these tools within our products varies between the countries and communities that we work in, reflecting that those regulatory frameworks that we obviously need to adhere to.
So finally, could you just summarise some of the key strategic priorities, milestones and catalysts that investors should watch out for across the next 12 to 18 months?
As we look to H2 for 2025, we will certainly continue to build on the first 18 months impact in California. We'll double down on growing our reach and supporting more youth with product innovation, continue to build advocacy, further embed into the healthcare, education and community systems, and serving to accelerate success in California to really kind of underpin our US growth strategy. We'll certainly grow usage and advocacy in New Jersey, continue to work on our 2025 state and payer pipeline, really paving the way for our strategic state alliance model, which I alluded to earlier in 2026. Over in the UK, we will surface and support targeted populations that need our help, particularly those that are aligned to political priorities, and apply our flexible model of support. And we have a plan also to bring back the enhanced Saluna product from the US within that context. And finally, and critically, we will communicate the impact of our work. We'll be more front-footed in terms of communicating in a mixed landscape the priority that we are evidence-based, a sector leader in safety. We've got proven system integration and an advocacy approach. We're a digital innovator, but we're also really user-focused. Sanjay, I'm sure, is happy to restate the strength of our financials again. But from my perspective, before handing over to Sanjay, with all of this in place and with the continued demand for our services, where traditional models of care are not meeting the need, we can turn our focus to accelerate innovation and ensure that we are even more closely aligned to government policy in both the UK and in the US. And as I said, use California as that unparalleled reference site as we move to a single global product.
Yeah, thanks, Kate. And just to add, from a financial perspective, look, California is an incredibly important contract for us, so we're going to be investing heavily across the course of 2025 in driving usage and engagement with our service, particularly across those sort of hard to reach communities. Look, that will have a financial impact, so we won't expect to see the same type of EBITDA results we saw in 2024, and we've flagged that quite clearly. But for us, this is very much an investment in that contract, and we'd expect to see the benefit of that as we sort of go into 26 and 27.
Excellent. Kate, Sanjay, thanks very much for the insightful discussion. Looking forward to following your progress as we move into the second half of 2025. If our audience would like to learn more about the company, please refer to the Kooth website. Sanjay, Kate, thanks again for your time.
Thank you.